Hi everyone. For my demonstration today, I'm going to show you how to set up a sterile field. So here I have my dressing tray. I have my solution that I'm going to use to clean off my wound. I've got some tape. I've got a selection of extra supplies here. I've got my Duoderm dressing, and then I have some 2x2 and 4x4 gauze that I'm going to use to clean and dry the wound later. And then I have a pair of sterile gloves. On my tray, I'm going to look and make sure that everything's in here that I need. So if I have to add scissors, if I have to add an extra pair of forceps, I can do that. I'm also going to check for an expiry date and make sure that this tray hasn't expired. I'll also look for any breaks in the packaging. If there's tears and breaks, I need to just throw this away and get a new bag. There is a perforation on here. You basically break the perforation and then your tray is exposed. I'm going to find the flap. So when you're opening a tray, we want to make sure that we've got our tray at waist height. I've done good hand hygiene before I've started as well. And you want to open everything away from you. Okay, so waist height, everything away from you. So you see this little flap here? I'm going to take that and move it away. Peek over here, and there'll be a set of forceps. So I'm going to hang on to those, and I'm going to square off my tray. So basically, 1 inch or 2.5 centimeter border around this entire tray is considered non-sterile. So everything in the middle is considered sterile. On the top of this tray, I have a drape that I can use to create a field by my patient. I've got my tray, and then I've got my supplies. There's a little garbage bag that's included in here. I'm going to take that and I'm going to put it over to the side. I can arrange my forceps into my tray. My scissors I can put to the side. I'm going to take my little 2x2 gauze. I'm going to put that to the side. As well as my larger 4x4 pieces. If I choose to use these again, I can place them back on my tray, but where I've touched here on the handle, I have to ensure that stays on the 1 inch border. And the tips of the forceps have to be sitting on the sterile part of the tray. So like so. I'm going to take my garbage out. Open that up. And I can actually tape it to the corner here and use that to put my stuff in. So to add fluid to my tray, I'm going to take my saline solution. Again, I want to make sure that it hasn't expired. These are 1 use only, so once I'm done with this, I will have to throw the rest away. I'm going to open the package, and I'm going to lip it. So basically what that means is I'm just going to pour a little bit of the solution into my garbage can just to kind of sterilize the spout. Then I will add my solution to my tray. You want to make sure that you're close enough to your tray that you aren't going to splash. Once I've added that to my tray, I'm going to put that in the garbage. I now can start adding my supplies. So for my gauze type supplies, what I'm going to do is there's a little arrow at the top, and this is where you would be opening. I'm going to open, I'm going to peel back like so, and then I'm going to place on my tray. Again, I'm going to peel back and place on my tray. So you want to make sure that everything's getting placed within that sterile field and nothing is hanging over the edges in that 1-inch border. The other thing you can do if you're not good at dropping supplies onto the tray is you can take your gauze, open your package like so, and then you can use the forceps that you have on the side here because the tips are still sterile, and you can use those to actually remove stuff from your tray and place it on your sterile field. So that's another option. So you're going to continue until you have everything that you need on your sterile field. The next thing you're going to do is you're going to apply your sterile gloves. So your sterile gloves come in a package like this. These ones are non-latex. They're a size 7. So the higher the number, the bigger the size of gloves. You're going to remove them from your packet. And what I'm going to do is I'm just going to move this tray this way, and I'm going to place my gloves here so that you can see. So there's a right and left hand side. We're going to open the gloves. And we're going to start with the dominant hand first. So you're going to pick up the glove by the cuff, and I'm going to slip my hand in. Don't worry about the cuff at this moment. It's going to kind of look like this. We're going to straighten that out a little bit later. With my dominant hand, I'm now going to reach, thumb up, into the cuff of the other glove. Like so. And then I'm going to place my second hand into this glove. Don't worry if it looks a little wonky. Once you've got it kind of on your hand, you can straighten that out. Here I'm just going to go under the cuff and straighten this one out. This one here, there's not much I can do about it. I should have taken my watch off, but my gloves are on now. I'm going to grab this by the center, move that away, and then move my tray forwards towards myself. I now have to keep in mind that my hands are sterile, so that forceps that I had, a blue forceps, I can't use it any longer because if I grab it by the end, I'm going to contaminate my hands. My hands need to stay above my waist, so they can't be dropping here, otherwise I'm kind of breaking my sterile field. So hands have to remain up. My hands are sterile now, so I can touch anything on my sterile tray. So here's where I can start organizing things on my tray to ensure that I have everything that I need and it's within reach and within view. So I can add these to my water, etc. When you're doing the dressing procedure, you have to always make sure that items that you're using, that you're replacing them and putting back on the tray, except for the dirty items. So if I were to clean a wound and I've used a swab, it's going to go in my garbage. But all of my forceps and things like that, I can't leave them on the corner like this. I have to leave them in the tray. But we're going to do dressing changes a little bit later. This just gives you an idea how to set up a sterile tray and how to glove. Thanks.